This is general information and is not specific medical advice. Always consult with a doctor or healthcare provider if you have questions or concerns about the health of a child. In the event of an emergency, call 911 or go to your nearest emergency room. Any unauthorized use of this program may violate United States copyright laws. Please contact Children's Healthcare of Atlanta for information about obtaining license or permission for use. To change your child's central venous access device or CVAD dressing, remove any jewelry on your hands and wrists and clean your hands. Gather all of your supplies. You will need clean gloves, a pair of sterile gloves, sterile gauze, a swab stick to clean the skin, a clear sterile dressing like Tegaderm, Sorbaview, or Bioclusive, an antimicrobial patch like BioPatch, masks for everyone in the room, a securement device like StatLock or GripLock if used, a watch or clock with a second hand, skin protectant if needed to protect the skin from StatLock or GripLock adhesive, and adhesive remover like spray or Unisolve wipes. If you use a kit, check the supplies included in the kit and gather whatever is missing. Your home supplies and kit may look different, but the process will be the same. Follow the instructions that come with your home care supplies and ask your home health company if there are any special instructions for your child's supplies. At home, find a room where other children and pets will not interrupt you. Make sure all fans are off and the windows are closed. Place dressing change kit and packaged sterile gloves on a clean surface or towel. Make sure the clean surface is dry before placing supplies on it. If possible, have another adult with you during the dressing change. This person may help distract your child or even help you with the dressing change. Remove your child's shirt. Place a mask on your child and then place a mask on yourself. Any helpers in the room must also wear a mask. Next, wash your hands for at least 20 seconds with soap and water. You may also use alcohol-based gel or foam instead. Put on your clean gloves. Now set up the supplies in a sterile field. A sterile field means there are no germs on the unopened supplies. These items need to stay clean until they are opened and used. Start by opening the kit. Do not touch the dressing and cleaning supplies without wearing sterile gloves. Open any additional supplies that are not in your kit. This may include the antimicrobial patch, StatLock or GripLock, skin protectant wipe, and dressing. Drop them onto the sterile field. Once your supplies are set up, it is time to remove your child's dressing. With clean gloves on, carefully peel off the dressing and antimicrobial patch. You may need to remove the dressing with an adhesive remover. The skin under the dressing can be very sensitive, so this part of the dressing change may cause some discomfort. Never use scissors to remove your child's dressing. You could accidentally cut your child's CVAD, which could cause your child to bleed or get an infection. If your child uses a securement device like StatLock or GripLock, gently remove it now. Check the CVAD insertion site for any redness, drainage, leaking, swelling, or pain. If you see any of these things, make sure to call your child's doctor immediately after completing the dressing change. Remove your gloves and clean your hands with alcohol-based gel or foam. Do not leave your child at this point to wash your hands at a sink. Now it is time to put on your sterile gloves. Be careful not to touch the outside of the sterile gloves with your bare hands. Once both sterile gloves are on, only touch what is in your sterile field. This is to help prevent the spread of germs to your child's CVAD. Next, clean the skin. Scrub the line and skin around the insertion site for 30 seconds. Use the swab stick and scrub the skin around the CVAD using friction and a back and forth motion. Pay close attention to cleaning the insertion site and any skin that will be covered by the dressing. If you need to move the line to clean, grab it with a piece of sterile gauze from your kit. Allow the skin to dry. Do not blow or wave your hands to dry the skin. This could spread germs to your child's CVAD. Make sure the skin is completely dry before moving to the next step. If your child uses skin protectant, apply it now and allow it to dry completely. Next, place the antimicrobial patch around the CVAD insertion site. Try to line up the slit with the line. Now place your new dressing over the clean area with the line directed away from any dirty areas. If extra sterile tape is needed to keep the dressing edges attached to the skin, you can add it around the edges of the dressing at this time. Make sure to write the date on the new dressing. This will help you and your child's care team to remember when the last dressing change was done. If your child uses a securement device like a stat lock or grip lock, you should place a new one on at this time. Finally, throw away your old supplies, remove your gloves and mask, and wash your hands. CVAD dressings should be changed every 7 days and right away if they become wet, dirty, loose, as in the edges are coming up or the dressing is not sticking to the skin, or fall off. Never add extra tape to the dressing if it starts to peel back. Your child cannot go swimming while he has a CVAD. He should also avoid getting in water above the waist, including baths. Your nurse can show you how to protect the line while bathing to help prevent infection. Your child may take a shower as long as the CVAD is well protected from water with plastic wrap. Talk with your child's nurse to learn more. Please be sure to practice this on your child before going home. Remember to call your doctor for any questions or signs of infection like fever, redness, swelling, drainage, or pain. In case of an emergency, go to the nearest emergency department or call 911. Thank you for choosing Children's Healthcare of Atlanta.